Hi, I'm Dr. John Sargent, Chief of Child Psychiatry here at Tufts Medical Center, and I'd like to talk with you about dealing with conflict in your family at the time of COVID-19 and highlight the importance of listening. One of the challenges of enforced isolation is being with family members consistently. We're not used to this. While this is an opportunity for enhanced respect and care, it can also be a source of irritation and misunderstanding. For those of us in the hospital, there is the additional challenge of managing our fears and those of family members for us and for themselves. We can all find our lack of control disruptive. Family members can differ in their view of how best to respond. Minor differences can be the source of significant disagreements, and fear and worry can lead to battles over control and to resistance between parents and between parents and children. For those working in the hospital, exhausted when home, uninterrupted rest may be essential, but may be felt as further isolating family members. We are all worried about ourselves, our loved ones, our financial well-being. We can also find ourselves worried about the most disadvantaged and the families who are losing loved ones to the virus. We all have less emotional reserve and can become edgy and reactive. This shared sensitivity can leave us more easily hurt and more ready to be hurtful and reactive in return. What to do then? How to help ourselves and our families, and how to repair relationships when conflict flares up. The most important thing is to listen, to hear what is said with a desire to understand. In moments of conflict, the first effort should be to agree to slow down, to sit and focus attention, and to speak and listen in turn. Perhaps the family can discuss together ground rules for disagreements. Family members can agree to notice disagreement early on, to identify it, and agree to slow down, allowing each involved family member to have a voice that is heard. The goal of any conversation can be to appreciate each other's point of view. If decisions can be shared and wishes expressed, closeness can grow and family members can feel supported. Another helpful approach, especially with children, can be to set aside a time for expression of sadness about what has been lost or is threatened, and for complaints about what cannot be. We can be together in complaining as well as together in getting through it. It's also important for parents to know that no matter how much they want their children not to worry or be afraid, they cannot make the cause of their children's worry go away. But they can promise to be with their children with love and care. One additional agreement families can make is to agree to disconnect from discussions when things get heated. By agreeing to this beforehand, a request to discontinue a disagreement is not seen as an imposition or as an assertion of power, but rather a decision that all have agreed on to preserve harmony. If family relationships seem persistently stressed, a mediated conversation can be very helpful, even if conducted by video. If family stress is associated with pre-existing health, mental health, or substance use concerns in parents or children, virtual support groups, virtual conversations with friends or professionals can be very helpful. If threatened or actual violence is a concern, police or emergency help may be needed and essential. In summary, everyone in the family needs to speak and be heard. Agreements can be made by the family about how to deal with disagreements before conflict arises, and that can be very helpful. As much as possible, differences are best accepted and respected. Family members need to be patient with one another and to appreciate that everyone is stressed and frightened. Whenever possible, family members should celebrate their connections and the fact that they are there for each other. This is not a time to make major decisions or significant life changes. I hope these thoughts have been helpful to you. Thank you for listening.